MLT Case Study Series 28. The Hidden Malaise, Navigating Through Hypothyroidism. A case study on the clinical and laboratory diagnosis of primary hypothyroidism. Background information on hypothyroidism. Hypothyroidism is a common endocrine disorder resulting from the low production of thyroid hormones by the thyroid gland, primarily thyroxine, T4, and triiodothyronine, T3. This condition can lead to various clinical symptoms such as fatigue, weight gain, cold intolerance, constipation, and depression. The etiology of hypothyroidism can be classified into primary, resulting from thyroid gland dysfunction, secondary, due to pituitary gland disease, and tertiary, resulting from hypothalamic disease. The diagnosis of hypothyroidism is primarily based on laboratory tests, including TSH, thyroid-stimulating hormone, elevated in primary hypothyroidism due to reduced feedback inhibition on the pituitary gland. Free T4, low in primary hypothyroidism. It provides a direct measure of the thyroid hormones produced by the thyroid gland. Free T3 may be tested but is not a primary diagnostic tool for hypothyroidism. Thyroid peroxidase antibodies, TPOAB presence can indicate autoimmune thyroid disease, Hashimoto's thyroiditis, a common cause of hypothyroidism. Case study. Patient presentation. A 45-year-old female presents to her primary care physician with complaints of fatigue, unintentional weight gain of 10 kilograms over the past year, and difficulty staying warm. She also reports constipation and dry skin. There is no significant family history of thyroid disease. Laboratory investigation. Blood samples were sent to the laboratory for analysis, with the following results. TSH, 10 μ/L, reference range, 0.5 to 4.5 μ/L. Free T4, 0.7 ing/DL, reference range, 0.9 to 1.7 ing/DL. Free T3, not tested. TPOAB, positive. Diagnosis. Based on the clinical presentation and laboratory findings, the patient was diagnosed with primary hypothyroidism, likely due to autoimmune thyroiditis, Hashimoto's thyroiditis, as indicated by positive TPOAB and elevated TSH with low free T4 levels. Discussion. The diagnosis of primary hypothyroidism in this case is confirmed by the elevated TSH level, which indicates that the pituitary gland is responding to low levels of circulating thyroid hormones by producing more TSH in an effort to stimulate the thyroid gland. The low free T4 level corroborates the diagnosis by showing that the thyroid gland is not producing adequate amounts of thyroid hormones. The presence of TPOAB suggests an autoimmune etiology, specifically Hashimoto's thyroiditis, which is the most common cause of hypothyroidism in iodine-sufficient regions. In Hashimoto's thyroiditis, the immune system produces antibodies that attack the thyroid gland, leading to inflammation and diminished hormone production. Significance for medical lab technologists. For medical lab technologists, understanding the interplay between TSH, free T4, and the presence of thyroid antibodies is crucial in interpreting results related to thyroid function tests. Recognizing patterns consistent with hypothyroidism can aid in timely and accurate diagnosis, which is essential for initiating appropriate treatment. Treatment typically involves thyroid hormone replacement therapy, with levothyroxine being the medication of choice. Thank you. Please subscribe for more videos.